Hi, Dr. Marion Owen with Whole Family Medicine. So I'm sitting down after my walk on the day after Thanksgiving because during my morning walk, I had three separate patients contact me about COVID exposure over the Thanksgiving break. So wanting to know what to do, yada, yada, yada. So I thought, well, I'm just going to hit the highlights again so that I can refer every one of you who calls from now on back to this video. Watch it first, let it answer your questions, and then reach out to me for things that I'm not answering here because I can't answer 3 calls every hour. So, of course, I am hugely disappointed that a lot of people have been exposed. That is unfortunate, and it just speaks to the fact that our exposure rates are going up because you guys have been on the whole so super careful that it's on the rise. So I don't blame anyone who's called me. I totally understand all the situations, but this is going up. I'm going to be getting more of these calls, so I thought I would just quickly summarize what people are and the answers to what I'm being asked. So first, what is an exposure? So if you were within 6 feet of someone who was symptomatic or someone who was later tested positive for COVID, and it's within 2 weeks before them testing positive, so it's a long back run, then you have been exposed, and you should consider yourself contagious. So you need to quarantine until you have a test result that says that you're negative. And quarantining doesn't mean going to the grocery store real quick. Quarantining means not going to the grocery store. So you and anyone who's been exposed needs to stay at home and not risk exposing other people. So that is why we have wonderful things that will deliver groceries to you. That's why you have friends that can help you reach out to the people you need to reach out to. Do not be a super spreader. Even when you wear a mask, you can still be spreading it. So it's not like, oh, well, let me put on a mask and go to the grocery store. No, you can't. That's not fair to other people. So any extended exposure, and extended exposure is somewhat loose, but I would say anything more than just a few minutes with someone who was symptomatic or was later tested positive within 2 weeks after being around you, whether they were wearing a mask or not, whether you were wearing a mask or not, you need to consider yourself contagious. So when do you test? From the time of your exposure, your tests are most likely to be accurate on days 6 to 8 after that exposure. So what do you do in that gap time? Consider yourself contagious. Consider yourself at risk. And I'll tell you the things in a minute that I think that you can take that have enough data that I would do them and little enough harm. Certainly that they are very safe, and that's what I do. It's what I did. This is an extended period of time. You know, if you got exposed and someone called you today and says, oh, yesterday when we were together and I got my positive test back. There's my friend's dog jingling her chain. I got my test back and it's positive and I'm sorry. I really didn't think it was going to be positive, blah, 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 whatever they say. You are now, boom, contagious until you get this negative test. So you have to wait 6 to 8 days to get your test. Don't do it right away. A negative test 2 days after exposure is not a result. It's not valid in any way. So you have to wait that week and assume you're contagious and then take care of yourself. But that means quarantine, isolate from family members, anyone that might not already be exposed, isolate from them. So in 6 to 8 days after that exposure, you go get a PCR swab. You can do that at minute clinics around here. You can do that at the state sites. There is a wait time, but if you just got exposed yesterday, you're going to need to go ahead and get signed up because in 6 to 8 days, you should be able to get a test. Then you need to continue to quarantine until those test results are back. So that's going to be like 2 or 3 more days because they're doing more tests, yada, yada, you know the drill. So that is what you do. I'm sorry, but that is what you do. It is inconvenient. It is annoying. It is financially difficult. It is all of those things, but that is what you do. Okay, so then what can you do to try to not get as sick as you might get? So there's good data that melatonin, which is normally used in very small doses for sleep, 1 to 3 milligrams, never more than that for sleep, taken at 10 to 20 milligrams at bedtime, and I would take it at bedtime because it makes you sleepy, once a day, has some antiviral effect. So there have been a few small studies that really support that. So that's harmless. Go for it. Melatonin, 10 to 20 milligrams at bedtime. Vitamin C as ascorbic acid. The reason as ascorbic acid is because that's the least likely to cause diarrhea, and you want to be able to take high doses. So ascorbic acid is the one you'll be able to tolerate the highest doses of, starting at 1,000 milligrams 3 to 4 times a day. If you can take more and not have diarrhea, go for it, but try to at least take that much. With every dose of the vitamin C, take 500 milligrams of bioflavonoids. Bioflavonoids they come in vitamin C containing foods, and they help your body recycle vitamin C. And they also have their own data that they help prevent COVID, and they're easy to get your hands on. You can get a DoorDasher to bring you some from Whole Foods or Sprouts, no problem. Zinc, 30 milligrams of zinc every day. If you got my earlier videos and watched them and are following those protocols, you don't need to change anything. You're already doing everything right. Just keep doing that. Recently, there was some, you guys might not have been following, but there are episodes or occurrences of younger, very healthy people having big strokes around COVID, and it has to do with clotting and bleeding changes that happen with the inflammatory cascade. And there was a recent study, fairly small, but convincing enough, and again, the intervention is harmless enough that this makes sense. So if you are someone that has a tendency toward inflammation, so if we've told you your CRP is high, if you have had a blood clot in the past, if you have an autoimmune disease, a baby aspirin every day may prevent that outcome. And that, again, is fairly safe. If you have a bleeding tendency, don't do it. If you're not sure whether you should do it, you can text me. But not everyone needs to do that, but certainly people who know they have that risk need to do that. So those are the things to do. Please behave responsibly. Our numbers are going up. Christmas is coming, and more people are going to be traveling more. So protect yourself from it as much as you can. And know that in the grocery stores and everywhere else, there are people who are not being as careful as you. So if you can afford to have those things delivered, if you are in a high-risk category and there are friends that are willing to shop for you, check your pride at the door and let them shop for you. This is time to really close back down and be careful with yourself. Anyway, I hope you had a happy Thanksgiving. I'm sorry that I'm just doing this really quickly, but it's distressing to me that I've already gotten 3 calls this morning. So please be careful with yourself. Please, please. Be well. Let us know if we can do anything for you.